Prostate cancer is the nation's second leading cause of cancer deaths, but if caught early, patients can survive with a good prognosis. Early screenings, knowing your family history, even being mindful of some of the earliest symptoms can all save a life and prevent cancer deaths. Joining me this afternoon is Dr. Timothy Quillen, a board-certified radiation urologist and prostate cancer survivor, Ronald Rusnak. Thank you both for being here today.
Thank you.
Thank you, Mo.
Well, Dr. Quillen, I'll start with you. Is any man more prone to prostate cancer than another?
Well, certainly there are family histories that run through. There's some risk factors that potentially make the likelihood greater, obesity being one, potentially smoking, but truly can occur in essentially any male as they age.
What are some of the earliest symptoms that a man should be aware of that could indicate prostate cancer?
Well, and that becomes the issue. Most times there's not a symptom. There can be some mild voiding symptoms. The true symptoms of prostate cancer are late in the disease, pain and weight loss, those sort of things. So that's why the PSA becomes so important in screening.
We hear so much about these early screenings. In your history with the patients, has it made a big difference in whether or not it's a good or bad prognosis?
Oh, it's truly shifted the age of diagnosis way back so that we rarely now have patients die of prostate cancer. You've heard the common expression, you die with it, but the management along the way is what is so critical. Finding prostate cancer early on, making sure that we know how it tends to progress, and then we don't overtreat or undertreat is the key to the PSA and detection.
Ronald, you were obviously diagnosed with prostate cancer. What were some of the first symptoms you saw?
Well, the way they found it was when I had my met with the doctor and had the rectal, and they felt the polyps. So then they sent me to the urologist, and then he did like a colonoscopy and took samples and sent them to the lab, and found out of the 12 samples that they took that 5 were cancerous, but they were in the early stages.
And you're a survivor. You were telling me you just finished up treatment here recently.
Yes. On August 6th, I finished up 40 treatments, and I have to wait another couple of weeks and get a PSA taken and go from there.
Obviously a very good health story here. Ronald Rusnak joining us as a cancer survivor. Thank you. And Dr. Quillen, thank you for being here today.